Hello. This portion of your preoperative education will cover what you need to know from a therapy perspective going into your total joint replacement surgery. First, we will cover therapy involvement and expectations. Next, we will discuss your preoperative exercises before moving into equipment needs. Lastly, we will discuss safety in the home and strategies to prevent falls. Prior to surgery, we ask that you all begin your preoperative exercises twice per day and continue them until you have surgery. If you are planning to go home the same day as your surgery, you will be scheduled for a preoperative PT visit at the clinic. Please bring your walker and your patient education book with you to this appointment. This is usually scheduled about 2 to 3 weeks before your surgery. Before you discharge from either the hospital or surgery center, you may see both physical therapy and occupational therapy. Physical therapy is focused on making sure your strength, range of motion, balance, and walking are at a safe enough level for you to return home. Occupational therapy is focused on dressing, bathroom tasks, bathing, as well as techniques to reduce swelling. After you discharge home, you will have outpatient PT scheduled at the clinic, and you should continue your exercise program until that appointment. Next, we will move on to the preoperative exercises. We'll start by talking about the 5 W's for those exercises. The who. These exercises are for everybody, regardless of surgery type. The what are all the exercises that we reviewed today. We'll focus on the surgical side, but you can certainly do both legs. Where? In bed. You may be able to safely get on and off the floor now, but that is not something that we want you doing during your initial recovery from surgery. So, do these on your bed to keep it consistent. When? Every day between now and your surgery. Your goal is 2 times per day, 10 to 15 reps of each exercise. And the why. The research shows that the stronger and more flexible you are going into surgery, the better your outcomes are. Remember, some pain is okay when starting new exercises. Muscle soreness is expected and actually okay as it shows that you're building muscle. But avoid the sharp, grindy arthritis pain that is probably consistent with what you have now. If you get this pain or you notice an increase in swelling, take a break from that exercise and come back to it in a couple days. Now let's get to the exercises. The first is relatively simple. It's an ankle pump. Point your toes down and pull them back, moving them back and forth in a slow, rhythmic fashion. The next exercise is a quad set. Keep your leg straight and push your knee down by tightening the muscle on the front of your leg. Hold that for 5 seconds and avoid holding your breath. Gluteal sets. Your gluteals are a fancy word for butt, so basically this is a butt squeeze. Squeeze your butt muscles together, hold for 5 seconds, and avoid holding your breath. Heel slides. The name describes exactly what you need to do. Slide your heel back towards your buttocks. If you need help, you can use a strap, a belt, or a rolled up sheet to assist. Just hook it around your heel and use your arms to help pull back. Short arc quads. You'll need something that is about 8 to 10 inches thick to put under your knee for this exercise. You can use pillows, blankets, an old coffee can, or anything else. Just make sure that it stays thick when the weight of your leg is on it. Your knee stays down on the roll that you made, and you kick your foot up to make your leg straight. Hold that for 5 seconds and lower it back down. The last exercise is long arc quads. Sit in a chair, ideally with your thigh fully supported. Kick your foot up towards the ceiling until your knee is straight. Hold for 5 seconds and do not hold your breath. Not necessarily an exercise, but something we want you to practice is stairs. The proper way to do stairs after surgery is to ascend the stairs with your non-surgical or good leg and descend the stairs with your surgical or bad leg. Think about it in terms of which leg is doing the work. To go upstairs, you lead with your good leg as that leg is lifting you up onto the step. When going downstairs, you lead with the bad leg so that your good leg is on the step, lowering you down onto the step below you. Some patients remember the phrase, up with the good, down with the bad, or the good go to heaven and the bad go to hell. Next, we'll move on to our equipment recommendations. The most important piece of equipment that is absolutely necessary for you to obtain is a walker. We want all patients to get a walker before surgery and to bring it to the hospital with you, and we'll talk on an upcoming slide about options for where to get one. There are two main types of walkers. There is a standard front-wheeled walker with wheels in the front and either pegs, skis, or tennis balls in the back. This is the one that we want you to get. This walker allows you to walk normally while also providing good stability. The other type of walker is called a rollator or a four-wheeled walker. This type of walker is great, but it is not ideal for after a knee or a hip replacement, as they're not meant to take that much weight and they're much less stable given they have four wheels. Though it is different for everybody, a good estimate of how long you will use the walker is about 2 to 4 weeks. Some people are even less than that, and some people are a little more than that. It just varies on every patient. Another question that we commonly get is, what about crutches? And we actually generally advise against this. Very few patients are able to safely use crutches right after a surgery like this. And those patients tend to have really good upper body strength, really good balance, and pretty recent use of crutches. But again, the vast majority of our patients use a walker, and that is what we recommend for everybody. Next is canes. Canes are not absolutely required, but many patients do choose to get one. Canes are often used as a transition device, as people will start with a walker right after surgery, and then transition to a cane before moving to nothing. Similar to walkers, there are different types of canes, but the kind that we recommend is just a basic adjustable cane that comes with a single point at the end. When you get a walker and a cane, we want you to make sure that it's the right size. They are all adjustable, but only within a certain range. So someone that is 6 feet tall, for example, would not be able to use the same walker for someone that is 5 feet tall. To fit a walker and a cane, it is quite simple. Stand up as tall as you can with your arms down at your sides. The hand rest should come right to where your wrist bends. If you're not able to actually lay eyes on the walker and stand next to it, most walkers do say the range that they can be adjusted to. It's important to note that different companies use different terminology around their walkers, but it isn't consistent, so don't pay much attention to the wording. What some companies refer to as simply an adult walker, another company may call standard, regular, or tall. So again, don't pay much attention to the words. The only word that you should pay attention to is the word bariatric. Most walkers have a weight limit of about 250 to 300 pounds. So if your weight is above that, we recommend looking for a bariatric walker, as those are designed to accommodate increased weight safely. This slide shows some of the other equipment that can be helpful after a hip or a knee replacement, but none of it is absolutely required. It can just make life safer and easier for patients. Some patients choose to get none of this equipment, and some patients choose to get all of it. On the top row, you have a raised toilet seat. Many homes have very low toilets that can be difficult to stand from after surgery, so these devices raise the seat height to make it easier. A reacher, a sock aid, and a long shoehorn are for putting on your pants, socks, and shoes if you will not have any help for those things when you go home. On the bottom row, a shower chair can go in the shower or a tub so that you can sit while bathing or showering, while the transfer bench is specifically for a tub. 2 of the legs go into the tub, and 2 of them go outside of the tub, so you can sit on the bench and scoot over rather than climbing over the edges of the tub. Grab bars generally go into a shower or next to a toilet for added stability, and a long-handled sponge is for cleaning areas that are now more difficult to reach after surgery. All right, so where can you get this equipment from? We put together a list of options from cheapest to most expensive. The first and cheapest option is to borrow one. Many people have a walker that they use for a short amount of time or inherited from a family member. So ask around to friends or families and see if they may have a walker or other equipment at home that you could use for a short time. Next, most communities have at least some sort of option for a loaner closet. The best place to start for this is by checking out the senior center if your community has one, or by contacting the Aging and Disability Resource Center, or ADRC, for your county, as they will usually have some resources for loan closets. Another option is to check out the website loanclosets.org. You can search by county, and it will give you a list of places known to loan out equipment. This is certainly not an all-inclusive list, but can be a good place to start. Otherwise, even places like churches or VFWs often loan out equipment. Next are thrift or secondhand stores such as St. Vincent de Paul or Goodwill, as they often have newer used equipment that is very inexpensive. Some St. Vincent de Pauls also have loan programs, so if you don't see what you're looking for out on the floor, ask an employee, as they may keep their medical equipment and walkers in the back for residents to loan out. Next option is to just buy it new. There's lots of options for this. Big box stores like Target or Walmart, pharmacies like Walgreens, CVS, or your local pharmacy. Amazon.com has equipment. For example, a brand new walker on Amazon.com can run you anywhere from $30 to $40, just to give you a ballpark of the range of costs. I've also seen walkers at Costco, and I've seen medical equipment at places that you wouldn't necessarily expect, such as Menards, Home Depot, or Aldi. The last option is from the hospital, but we do advise against this. Sometimes this works well and we can bill your insurance, but if your insurance doesn't have a contract with the equipment company that we use, it can easily become the most expensive option. So if you've exhausted all options for equipment and are wondering if you can go through your insurance, please reach out and I'll look into your situation. Lastly, we'll talk about preventing falls and keeping you safe in your home after surgery. If we go room by room, starting with the living room, we'll want you to remove or secure area rugs and remove cords from pathways. The wheels of your walker will generally drive right over those things, but they're definitely a tripping hazard for your feet, and the back pegs, skis, or tennis balls of your walker will grab onto those things and can cause falls. Up in the bedroom, ensure that you have adequate lighting and enough room to get you and your walker safely to and from the bed. I used to do home health therapy, and I can tell you that one of the narrowest areas in people's homes is sometimes the area between their bed and their wall, or their bed and a dresser. So make sure you have enough room to fit you and your walker through that area. In the bathroom, we've already talked about some equipment like grab bars, but a non-slip mat in the shower or tub can also prevent falls. Lastly, in the kitchen, have easy to warm meals prepared, and also put frequently used items in easy to reach places. Again, we want you to ensure adequate lighting in every room. The example that we often use is that 2 or 3 a.m. bathroom trip in the middle of the night. When you are generally a little bit groggy and your knee or your hip are a little bit stiff and sore, you want to make sure that you have adequate lighting and clear pathways so that you can get to the bathroom safely. Clean up spills immediately, or preferably have someone else clean up spills immediately for you so that it doesn't create falls. Make arrangements for your pets so that they get the care and the exercise that they need. If you live on a multi-level home with a lot of stairs, many individuals do choose to stay on the first floor of their home for a few days, even if stairs are easy for them. If this isn't an option, don't worry, as we'll work on stairs with you. But if it is an option, consider doing it just to make things safer on you initially. Plan on getting in and out of bed on the surgical side. This isn't a requirement, but can make getting in and out of bed easier and a little bit less painful. Lastly, check the height of your chairs, couches, or beds. Things that seem low to the ground or difficult to stand from now will be that much harder to stand from after surgery. As a general rule, if the seat height is above the level of your knee, it is probably okay to sit in. But if it is below your knee, it is probably too low. That is everything that I have from the rehab side of things, but please reach out to me if you have any questions. Thank you, good luck, and we'll see you all soon.